Blackrock Clinic is a 168-bed acute hospital spread over 5 floors. We have 8 operating theatres. We carry out surgery in orthopaedics, cardiac surgery and general surgery. At present in Blackrock Clinic we have a number of opportunities for nursing staff who may be considering working in Dublin, Ireland, returning or visiting for the first time. We are also looking for staff who have experience in high dependency or critical care in the general ward, and we will certainly support them if they have an interest in working in this area.
Our vision is clinical excellence personal care, and this is emphasised from day one when you join this hospital. We are looking for staff or nurses who will, I suppose, embrace these values and understand what they mean in terms of the patient experience here in Blackrock Clinic.
Stuart Carr's my name. I'm consultant in emergency medicine in the emergency department in Blackrock Clinic. I was asked as part of a recruitment drive for a newly being set up emergency department to interview for the post. Found it sounded like a very challenging role, setting up a new department, and was happy when I got the job offer and joined in 2010. We only recently opened a new emergency department, so November of last year. We're up and running 6 months now since then, and it's a much more modern department with new equipment, and there's a lot of in-house training to get used to the equipment, and there's always someone at hand who has experience with that equipment as well. It's a more pleasant environment for both the staff and for the patients, and we have much better access then to diagnostics that patients would have elsewhere, and that brings a number of people to us. And the GPs will refer patients for very quick turnaround in terms of testing. So we would have same-day access to advanced scans like CT scans, ultrasounds, and often MRI scans on the same days. So we'll have quick access to beds. Patients will go up to the wards very quickly, and as I say, they'll have quick access then to investigations and specialist opinions as well. And that makes the patient journey much more pleasant. But also in terms of the nursing side of things, they will look after the patient for the time that they're awaiting their investigations and diagnosis to be made, and then the patient journey will continue within the hospital, and the nurses can move on to the next patient at that point in time. Radiology, laboratory, physiotherapy, in-hospital, cardiology, there's a lot of different departments that will interact with, some on the same day. Sometimes patients will be discharged home to come back a couple of days later for investigations and will represent to us with results of those investigations. So it's nice for the staff involved to see those patients improving as a result of some treatments that we've started. It's a very established hospital at this stage in a very established area. So Blackrock itself, it's a mature setting, and there's a lot of transport links. We're close to town, we're close to a lot of the sites of Dundee, Blackrock. The networks themselves are good in terms of travel, so you don't have to live in the immediate area to get in early. We have good restaurant facilities here, all food produced in-house, and certainly most people will find that they don't even need to bring in lunches with them because they have good access to food, both lunchtime and dinner time. The hospital has a sports and social club as well, and they'll partake in barbecues or trips to theatres or even golfing activities. And then within the emergency department ourselves will organise nights out and meet up for drinks or for dinner on a regular basis also.
When you want to work in an emergency department, you like the thrill of things changing from minute to minute and not knowing what you're going to get during the day. And that's something I think when you like emergency and working in emergency departments, it's the variation in the day that kind of keeps you going, and it's a good place to work. We have a good structure. We work as a tight team in the emergency department. It's a small emergency department, but everybody works together. So initially the patient will be triaged by the triage nurse and then handed over to the nurses on the floor. And then they look after, and we work quite closely with the consultants and radiology and other services in the hospital to progress the patient through as quick as we can. I like the diversity, and then as you work well with the team, you always have somebody to bounce, and if you're not sure of anything, there's always somebody to help you or to answer any questions that you're not sure of. There wouldn't be as many levels on the hierarchy of the hospital, so everybody kind of knows everyone, and the management are approachable. If you had a problem, then you can go and bounce ideas off and get support. There's a lot of in-house training regularly on any new bits of equipment. We have a lot of bedside equipment that we use to test blood sugars, to test iron ore levels, ketones, all that kind of thing. So we have link nurse training, and then that link nurse goes out and teaches the rest of the department about the equipment. There's wound care courses that you can apply to go on. We do casting courses as well. From the emergency department side of things, we would do a lot of plastering. So they run a course outside the hospital once a year, which we put names down and get our staff trained up in that as well.
Every day is different. That's what you get working in an emergency department. That's why I decided to specialise as such in emergency, as that's what I like. It's a very quick-paced place to work. A tough day would be an acutely unwell patient arriving to the emergency department, and you're pushing yourself in the position where you have to care for this patient. But along with all our colleagues, we'd have a good morale and good spirit, so we'd all work with each other to make the difficult experience much easier on everybody involved. That's what nursing is. It's full of communication. You're not only communicating with the patient themselves, it's the family members and any other relatives around. You need to always keep them informed, as coming into hospital can be an anxious time for everybody involved. I always thought I was good with people, a family person, and love my job. And I think you have to be a good nurse, you have to love it. So to anyone over in the UK or elsewhere, I would really advise to maybe think and consider Blackrock Clinic, as it is a fantastic place to work.